Hello everyone, welcome to my channel. Today I'm going to talk about black fungus, also known as Mucormycosis. So, before I begin explaining about black fungus in detail, I want to give an introduction about where you can see this fungal spores. And in today's topic, I'm going to cover where do you see these spores, who are affected, what are the symptoms, and what is the treatment plan for it. So, these fungal spores are present in air and they can be seen in rotting vegetables. They can be seen at construction sites. So, this is not a new fungus or something. This has been there since long time, but it is not frequently seen. It's more seen in immunocompromised patients, but nowadays, patients suffering with COVID have this type of fungus. And I don't think whoever are COVID positive needs to be very much worried about this fungus, but you have to have a knowledge about what are the symptoms so that in case you think you have the symptoms, you can tell your doctor right away about that. So, who are the people suffering with this virus? So, the people undergoing chemotherapy and who has uncontrolled diabetes, who has undergone recent transplantations, and patient taking steroids are at higher risk. Okay. And what are the symptoms that you can see? You can notice pain, you can you can observe chest pain, you can see redness, swelling, and you can see black patches in the intraoral region. So here you can see that the patient's eye is affected. Okay. So let me tell you something. Black fungus not just affects one organ. It can affect it can affect nose, it can affect nose, it can affect eyes, it can affect intraoral region, it can affect brain, and it can affect lungs also. Okay. And let me tell you something, this is not contagious. Okay. So if a patient has suffered from COVID and is at a recovery stage, imagine, like, let me tell you a situation where the patient has COVID and it's been almost 3 months. Still, the patient can develop this kind of infection because they have low immunity. Okay. Now, what happens exactly in COVID patients is they are immunocompromised. You can see lymphopenia. So, penia means reduction. So, the lymphocytes are less in number. CD4, CD8 cells are less in number. Lymphocytes are nothing but white blood cells that are body's main type of immune cells. Okay, so when lymphocytes decrease in number, these infections develop more easily. Okay, now let me tell you something about steroid treatment. So, in case of moderate to severe COVID disease, the doctor might prescribe steroid medications. And if a patient is also a diabetic, when a patient takes steroids, their blood glucose mechanism, the levels are disturbed. So, if a patient is already diabetic and it's uncontrolled and is taking steroids and has a black fungus, then it's a huge thing to worry about because steroids lead to blood glucose level disturbance, which creates a favorable environment for this fungus to grow. Okay, now you might be thinking, why do I have a picture of a dentist looking at a patient's mouth? And like, how can you know if it's a black fungus in a dental patient? So, this patient over here might have no history of caries and has a very good oral hygiene. But he has come to the doctor saying that he has pain in the maxillary posterior region and a severe pain. And when you see the radiograph, you see nothing much. But you can see that there is a discharge, there's a pus discharge. Okay, then you don't know what to do because the patient's history is pretty much clear. Okay, you can advise the patient to take a CT or CBCT of the particular region that you or the quadrant that you think like might be important to diagnose it, and you can refer the patient to ENT surgeon or oral surgeon. Okay, so in case of um, black fungus, what is the main thing to be worried about is noticing the symptoms. You can see it as a pseudomembrane grayish patch. You can see pus discharge. You can see discharge from nose. You can see like when you cough, you might be having, when you cough, you might be seeing like blood and your eyes might be swollen. So these are the symptoms that you should not miss. Okay. So here in the face, what are the things that can be affected? The nose can be affected, the orbit can be affected, the brain can be affected, and people can lose vision also. Okay. Now let us talk about symptoms of rhinocerebral mucormycosis. So rhino means you're talking about the nose sinus, and then like about the brain. There'll be one-sided facial swelling, so other side would be normal. You might experience headache, nasal congestions, black lesions are most important that you can see on the upper inside of the mouth or on the nasal bridge. You might have fever. Coming to lungs, pulmonary mucormycosis, you can see fever, cough, chest pain, and shortness of breath. You can also notice some changes in the skin where you can, it looks like blisters or ulcers, but the main thing is you can notice a grayish blackish discoloration. Okay. Whereas in GI mucormycosis, there might be abdominal pain, nausea, vomiting, GI bleeding, um, and when you cough, there might be like blood coming out. And disseminated mucormycosis typically occurs in people who are already sick from other medical condition. So you cannot, it's difficult to relate the symptoms. Okay. But if patients suffer from mucormycosis and it infects the brain, they can go to coma. So I hope you have got a clear understanding about the black fungus, that, you know, this is something that you need to be having awareness about it. I'm not saying that every COVID patient would be having black fungus, but it's better to know what are the symptoms. That is, you might have discharge, greenish discharge from your nose. There might be swelling, there might be black patches in the intraoral region, and there might be headache, nausea. And if you are a diabetic, please make sure that your blood sugar is in control. And if you're taking steroids along with it, just make sure that in case you have any symptoms, you tell your primary doctor who's treating for your disease right away. Thanks for watching, and please subscribe to my channel in case you find this video useful. And if you want me to make any videos in particular, leave your interested topic in the comments below and I will definitely make a video about it. Thanks for watching.